Hello, welcome to the webinar. We're going to give it a few moments for everyone to log in. And while we wait for that, you can go ahead and populate your name into the chat. Tell us where you're coming from. And we'll give a minute or two for everyone to come into the room. Thank you, everyone, for joining us. I'll just give a few moments. Good afternoon, everyone. My name is John Battaglia. It's a pleasure having you with us, and I'm one of the Deputy Directors for Early Learning here at the Hunt Institute. And for the benefit of everyone joining us for the first time today, the Hunt Institute is the creation of our founder and namesake, four-term North Carolina Governor Jim Hunt. And we serve as an education policy support for governors, state legislators, and other high elected state officials. We cover the full spectrum of educational policy from early childhood through the workforce. So as states look for solutions to the early childhood crisis, many are exploring those innovative solutions for increasing supply, expanding the teacher pipeline, and stabilizing the industry. And today we're going to look at several of those approaches with our fantastic expert panel that we have with us. And we are excited to be joined today by Linda Smith, the Director for Early Childhood Initiative from the Bipartisan Policy Center. We have Elena Trustworthy with us, the Deputy Commissioner from the Connecticut Office of Early Childhood. And also she's joined with Nicole Villanueva, sorry about that, our coordinator from the Child Care Incubator Project at the WYCA of New Britain, Connecticut, and Leslie Latimer, the Executive Director of the Palmetto Shared Alliance Services. But before we begin, I just want to go over a few quick housekeeping facts. Later in the hour, we're going to share with some of the questions from the panel with us. So if you'd like to contribute a question, please go ahead and share that in the Q&A function on Zoom, and we'll go ahead and add those to the end. So we do like to leave the last few minutes of this webinar for those questions that do come in. So please go ahead and share those as you come to and as you think about them, and we'll get to those at the end. Also, please know that today's session is closed captioned. So you have that option, and you'll see that on that setting panel on the bottom of your screen. And finally, you'll be able to find today's session on YouTube. So just go ahead and search on YouTube and find it under the Hunt Institute. So I'd like to kick us off today, and I'd love to begin with Elena and Nicole. So Connecticut has been playing planning a really innovative incubator model designed to increase the state's supply of family childcare. Can you share us a little bit about the rationale behind the incubator model and the results that you're starting to see?
Sure. Thank you, John. And just an overall thank you to the Hunt Institute for being such a leader in this field, helping to convene states. I know that we here in Connecticut have benefited greatly from the amount of sharing and learning that we can do across states. And so thank you very much for that. I want to start by recognizing the tremendous work and forward thinking of the partners who designed and are launching the very first incubator model in the country. I'm so pleased to be here with Nicole Villanueva here with me today, who's from the YWCA of New Britain, Connecticut. And she'll be able to talk about what the incubator model really feels like and what it looks like and how it's going to be operating on the ground. But from the state's perspective, we see the incubator as a promising model to really help expand and stabilize the childcare industry. This pilot program was established through Public Act, and it allows a family childcare home license to be issued to a provider who wishes to operate outside their home if they've partnered with an organization to provide childcare services in a space provided by that organization and further approved by the Office of Early Childhood. So this model allows licensed family childcare providers to work in a shared non-residential space. They can participate in comprehensive training and support. This helps create business efficiencies such as backroom administrative operations, and really helps to build the culture of working with the team and with others, especially in family childcare. But we know in our sector, right, isolation is something that we want to reduce, and we really want to be able to bring providers together in a way that is supportive and helps to build their business and to build their quality practices. And so, you know, New Britain is an example of a community that will be launching this pilot very soon. They've worked over the past few years to identify the building, bring it into compliance with licensing requirements, zoning, hire, you know, the coordinator, recruit and train childcare providers, amongst many other things that they're doing. And so we do anticipate that this incubator will be licensed by the Office of Early Childhood very, very soon. And this will bring additional capacity to this community. So the current legislation allows for 7 cities to participate in this incubator pilot across Connecticut. And what we know about these cities is that they have childcare deserts, right? There's high demand for infant toddler care, and where access to quality childcare can be limited. And the current statute also enables these licenses to be valid through 2026. Part of this work is, you know, a big thank you to all the local partners. This is really an idea that bubbled from the ground up. And so in philanthropy, thanking the philanthropic partners such as the Connecticut Project for being major supporters of this work. So I took a tour last week of the shared space and the incubator pilot, and it's really so exciting to see how this is coming together, the beautiful space that it provides. But I think more importantly, to hear the stories about the journey of those who are part of this incubator, right? The learning, the amount of support that they have, the amount of confidence in launching a new business and being in this very supportive environment.
Thank you so much. Nicole, so you oversee this fantastic incubator project in New Britain, Connecticut. And am I right to think that it's almost like a shopping mall in which multiple businesses operate independently under one roof? And can you tell us a little more about how this works and what kind of supports are being provided to those participating businesses?
Hi, thank you for having me in this webinar, and I have to agree with you. Yes, the incubator site can be compared to a shopping mall where each family home daycare operates independently under one roof. We recruited in September 2022, 10 women who meet the requirement that we prepare to be part of the incubator, but one of the important ones, it was to live in New Britain, Connecticut. After recruiting the 10 women, we conducted a 5-month training for the selected participants starting in December 2022. The curriculum was focused on various topics such as business and financial literacy, family home daycare license application, everything about regulations, and topics about early childhood. Some of these women have a background working with children, but other not. So we wanted to focus in different aspects that they will need to have a strong foundation. After the training program, we supported the selected participants to be part of the incubator site with aspects and like the LLCs, business insurance, state registration, IRS registration, startup grants. We continue with professional development as well, and they also got technology grants. 3 of these participants that are going to be part of the site are also finishing their CDA certification as part of a cohort that the School Readiness in New Britain provided. We were lucky to have 3 of our participants there. All of this, we prepared with the intentionality to create a strong foundation, and we ensured that all of the training was monthly customized according to the participant needs and interest. We developed a curriculum thinking in all of the aspects that they will need as new business owners, especially in the family home daycare, but we took very seriously what they really needed and provide those trainings. Additionally, we have prepared the incubator site that is going to meet all of the Office of Early Childhood licensing aspects and requirements. And for each of the family home daycare spaces, we prepare an environment for mixed ages, right? Including also a gross motor and a playground. The incubator site is almost ready to open, and we are very happy for that. And during the 3 to 5 year tenure of the incubator participants, all of them will continue receiving coaching, mentoring, resources, and support to be successful in becoming entrepreneurs as a family home daycare providers.
Thank you so much. And Linda, we're going to come over to Linda Smith. The Bipartisan Policy Center recently released a report on childcare apprenticeships. For those who might not be familiar, can you tell us a little bit what these apprenticeship models may look like and how common they are, and what states are seeing as a result of their implementation?
Well, I want to start out first by, well, obviously by thanking the Hunt Institute for this and for putting a spotlight on the issue of the personnel and how are we supporting our childcare workforce, because we see apprenticeships as one vehicle to support them. I don't know if any of your audience may have seen our webinar yesterday where we released a report on the challenges of the workforce and how we train and support them. And I just want to give a quick introduction to this, in that we have a lot of people in this field who come into the field with absolutely no training or education. In fact, in 28 states in this country, the only requirement to be work in a childcare center is an age requirement and nothing more than that. So one of the things, the work that we've been doing, and one of the things that we have seen apprenticeships, to answer your question, as one way to build pathways within our states for people to come into this field with little or no training and education in the field and move to higher levels. One of the things that we have been seeing in our workforce, and this is also tied to the issue of apprenticeships, is the fact that you can move up the ladder in terms of getting more training, more education, but you still get the same pay. And so that's been a real challenge for early childhood. How do we keep people when we don't reward them with pay increases? So the reason that we started looking at the apprenticeships has to do with both of those issues, okay? First of all, apprenticeships are not new. They've been around since the 1930s. The first national apprenticeship law was passed way back then. And so they're not new, and they're not even new in childcare. There have been a couple of states that have had apprenticeships all along. I mean, they've had West Virginia being one, Pennsylvania's had some apprenticeships for a long time. So they're not even new to childcare. But during the last few years, they have taken on a new sort of interest in a lot of states. And it's because of this issue of moving the staff to higher levels of training, et cetera. So that was originally our interest in this issue. And yes, we issued a report last year, and we looked at the apprenticeships in all of the states that we could find, and issued a report that gives an overview of what it looks like out there. Most states now have some effort along the apprenticeship line. And I want to also back up and just say to the audience that there's actually two kinds of apprenticeships. The ones that, the apprenticeships that the Bipartisan Policy Center supports are what we call registered apprenticeships. Because along with a registered apprenticeship comes some requirements, and that means that they meet requirements to be registered with the Department of Labor. So they need to include some things like criteria for, they need to have partners that they work with within the state. They need to have on-the-job mentors. They need to be led by the industry. They need to pay increases to the people as they work through the apprenticeship. And that's a key point, is that back to the problem with the field being stagnant in terms of wages. So whoever commits to an apprenticeship program must commit to some kind of wage increases as a result. They must also it must also result in some credential. And in the early childhood space, in childcare in particular, that credential in 70% of the cases is the Child Development Associate credential, a CDA. And that is the start point in many states for the field anyway, or at least we hope ultimately that it will be. So the distinction again is that whether or not the apprenticeship program is registered and whether it meets the criteria set forth for the, meeting the things like the credential and the wage increases. So where are we now? When we did our report, 10 states were using ARPA dollars to do this. 13 states were using preschool development grant funds. 15 states had apprenticeships in their state childcare plans. And then there were only at that time 5 states who had registered apprenticeships included in their what we call WIOA plans. And those are plans registered with the Department of Labor. Not to say they weren't registered apprenticeships, it's just that they were not in the state plans. So it's complicated and it's not, okay? The other thing I want people to understand about the apprenticeships, they can start with these entry-level people coming into the field, but they can include all of the different staffing levels. In 2 states right now that are working and doing outstanding things with apprenticeships and childcare management directors, Kentucky and Massachusetts are both looking very carefully at directors. And you could say, well, why don't they come in with a degree? And in most cases, I think our directors of our programs have some higher education, but what they don't have is business. And 90% of the people, the teachers in that, or 90% of the directors in this country come from teachers. And so they come into it with a clear understanding of child development, but not an understanding of how to manage a business. And so the states like Kentucky and Massachusetts that are looking at apprenticeships for directors, we're really watching very carefully. I think the other thing that we have been trying to work on here in the work we do is funding support for early childhood apprenticeships. Because, for example, plumbers, electricians, a lot of the tradespeople have apprenticeships. They also are mostly for-profit businesses. So doing some of the things required of a registered apprenticeships, like the wages, like the even setting up an apprenticeship, are challenging for a nonprofit organization or even, a childcare, for example, an association. Nonprofit status is not conducive to setting up a registered apprenticeship. So we have been actively trying to work with Congress in any reauthorization of the apprenticeships legislation to include some availability of startup money for apprenticeships within early childhood. I think that pretty much says it all. We can take questions later on. In our report, we give many examples of the apprenticeships going on around the country. There's a lot of innovation in this space. and a lot of space for innovation, which I think is probably one of the benefits of it. It can be developed to meet the needs of the communities and states. So happy to refer people to where there are, good examples of apprenticeships going on that are unique. And so with that, I will turn it back to you and we can take questions later.
Thank you so much. And Leslie, we're going to come over to you to talk about the Palmetto Shared Service Alliance in Greenville. And can you talk to us a little bit about what that means? What does that shared service mean in the context of childcare? And how South Carolina's childcare businesses are benefiting from that important work that you're doing?
Sure. So I'm going to follow Elena and Linda in thanking the Hunt Institute for shining the spotlight on shared services networks. We don't always get to share the work that we're doing. So thanks for that. And so just to give a background on what shared services are for those of you that don't know, a shared service alliance essentially brings together small early care and education businesses, organizations, centers, family home providers, all of that, to create a centralized infrastructure to help ultimately reduce cost, strengthen management systems, create efficient and standardized processes, eliminate duplication of services, et cetera. They pull together what we use as a small business into a larger shared structure that enables them to continue operating independently while benefiting from the cost savings and resources that an alliance can offer. So as John mentioned, we're in Greenville, South Carolina. That's where our home base is, but we have the rights to the shared services network for the whole state of South Carolina. So we have our office here, but we do all of the shared services alliance for the entire state. So part of what some of the shared services do is there's two types of models. One is a hub model. So it would be that a child care organization would have one hub that would have a director or an owner, one COO, for example, a CFO that would do all of that for multiple child care centers. That would be a hub. And then the way that we run ours is what we call web-based. And so everything that we do is we have web-based resources. So a lot of things that we do come from our resource platform that we use through CCA Global out of New Hampshire. And our resource platform is a comprehensive source for downloadable and customizable resources. And so I'm actually looking at our one pager here just to make sure that I don't miss anything that's super important that we have on that resource platform, because it is super comprehensive. But we have things like employee handbooks, parent handbooks, forms, policies, procedures, marketing toolkits, family childcare toolkits, parent handbooks, budget templates, posters, all of the things that you need. So it's essentially a one-stop shop. But two of the big things that we have are national cost savings. So you would be able to get cost savings benefits from places like Kaplan and Lakeshore, that we essentially become that hub, like I mentioned earlier, to be able to extend those benefits and those cost savings to all of the centers that are members of our platform. Then we also have what we call preferred vendor list. So those cost savings we have on a local level. So if you need mulch for your program, if you need healthcare, if you need food delivery, insurance, rugs, any of that kind of stuff, we can help you get that on a local level. The other thing that we offer, which we will discuss a little bit later, is healthcare benefits. That's really huge on our resource platform. The biggest thing that has been super helpful, particularly since COVID, is our job board. So we offer that through Acquire for Hire. And so we essentially have a one-stop shop where people come and they post their jobs, and it populates it out to 16 different job sites. So it goes to Indeed, Monster, all of those different things, and you put it in one time, and you're able to kind of see where your job is, if that makes any sense. So like if somebody is applying for the job, if somebody has been assigned to that job, if you want to interview for that job, it's all one click and you can see it all in there, and it gives you maximum exposure with one job posting. The other thing that we do as a shared services in our state is that we offer professional development. So we do that both in person and online through an online university, through our credentialing system, which is South Carolina Endeavors. And I know that Melissa Starker is on this webinar with us today. And so I'm excited to have her. And so our credentialing agency takes our professional development and is able to put it on our online university. So anybody, whether they're in our state or elsewhere, can take our professional development that's high quality and is able to kind of go on their transcript easily. So we have all of those different resources, but they're all web-based. And so that's the way that we run our shared services in South Carolina, as opposed to some of the other states that do it on a hub level, kind of all centralized through one location. And obviously all of these things being the one-stop shop for childcare providers allows them to run their business more efficiently, and allows them to thrive. And in most cases, sometimes stay open, because it's allowing them to save money, save time, and all of that. So it has definitely been an innovative thing for childcare. And I think it's going to be kind of the next big thing.
Thank you for sharing about that. It definitely sounds like a great resource, especially helping smaller centers collaborate and stay together and join in that. And Elena, we're going to come back around to Connecticut. And I know that Connecticut's Office of Early Childhood recently supported Governor Lamont with the Blue Ribbon Panel on childcare. And can you tell us a little bit about the panel and the panel's recommendations, and what innovations that you may see on the horizon as a result?
Sure. So yes, we just completed a very intensive community engagement approach for the Blue Ribbon Panel Plan. So about 12 months ago, through executive order, Governor Lamont established in Connecticut a Blue Ribbon Panel. This panel was made up of 23 members, including those representing businesses, childcare providers, family childcare, parents, families, legislators, and other stakeholders. And so this 23-member panel really engaged in a very intensive process and many feedback loops with the community to get to a report that was just recently published, which is a 5-year strategic plan for childcare for Connecticut. And so we are very excited about this work. I think as we think about all the exciting initiatives and potential when it comes to our childcare system, this 5-year strategic plan really creates a roadmap for the steps in the work that's needed to be taken in order to strengthen, stabilize, and build our childcare system in order to best meet the needs of all children and families across our state. And so the Blue Ribbon Plan really emphasizes the immediate need for stabilization and systems building, right, to prepare for expansion. It also prioritizes equity, right, understanding and looking at data to understand where the families and communities most in need and how do we reach and engage with those communities and families. It also puts the workforce really at front and center, right? So through this 11-month process, the panel went out to engage and have many public hearings, engage on one-on-ones, work with groups, work with businesses, many community stakeholders, and really want to thank our philanthropic partners who also made it possible to reach out to families. And so over 800 families were connected with for their input, ideas, and feedback when it comes to the needs of families across our state. And so what I can say is that what we started with and what we were thinking at the beginning looked very different at the end because of all this community feedback and input and our transparent process as we went through the process. So the plan really focuses on 4 major areas. So like I was saying, workforce equality is goal number 1, right? So what we heard from the field was that, you know, when we think about our childcare system and we think about growing and expanding and what is needed, we really need to be looking at and focusing at the workforce first, right? Many of us have been in this field for many, many years. We know the challenges of the low wages for our teachers and for our ECE professionals. The challenges around retention and recruitment right now as well. And so really saying that first and foremost, the focus on workforce is very, very important. And so some of those strategies under workforce is around simplifying the credentialing process, all right, for those who are both in our field and looking to come in as well. And so, you know, in Connecticut, we have, I think, currently about a 15-step career ladder. And it's not the most straightforward approach. And so the recommendation is to adopt a 3-step career ladder and to align compensation and credentials with the unifying framework. And it's also about helping programs to really maximize their fiscal health around stability and quality, and to have a focus on quality as well as we move through. The second goal is around equitable and affordable access, right? Making sure that families who need it most, but all families have access to the high quality programs that they need and want. So expanding the affordability for low and middle income families, really looking at our rates, our subsidy rates, calling for gradual increases in rates to allow for more families to enter into the system and to be able to afford access and care. And that we look at the supply and the increase in the supply for affordable infant and toddler care for families. And so I think that that's an important place to just focus on for just a moment, is that we know, and we, through our data, right, and through what we hear from families, is that the need for infant toddler care is absolutely crucial. And so this plan, the Blue Ribbon Plan, asks all of us to focus on the earliest years for families. We know that families who just have children at some of the costliest, right, times in their lives, and yet it is some of the most hardest to afford the high quality care of infants and toddlers. It also calls to focus on children with special needs and other needs within families and communities. The third goal is around systems, right? So ensuring that, and calling for our childcare system to be more agile, to be more flexible, to be able to respond, right, to the needs in a timely way, and to make sure that resources and supports are available for programs to be viable. We in Connecticut, we're very fortunate to have state funding that can go towards infants and toddlers and preschoolers. And we currently have about 8 funding streams that providers can access in different ways to support childcare within the state. We are calling, or the Blue Ribbon Plan calls to simplify that state funding system to better align with federal systems, and to have one place and one way in which providers can reduce their burden of complexity, right? The number of reports that they need to fill out, the number of applications that they need to complete, the different standards and requirements depending upon the funding stream. So making that whole system much easier for providers and also much easier for families to navigate, to know what they are eligible for and how to access it as well. Sorry. And then also under systems is ensuring that family voice is elevated and at the table. And as we think about provider needs and community needs, that family needs are also there, being able to inform and really drive the policies and practices at a state level. And the last focus area is around funding, right? Understanding and knowing that we need additional funding in order to be able to do what we need to do to have a well-funded system that is really poised to do the work that it calls to do. And so those are some of the major focus areas of the Blue Ribbon Plan. It is definitely something that we are using as our roadmap as we move forward. And it's a 5-year plan, but the first couple of years really focus on stabilization of the field and our systems changes. And the future years on the onset call for expansion and increased capacity. So with that, I will end. Thank you.
Thank you so much for walking through that. And that is something we'll also share on the resources around this as well, the Blue Ribbon panel. And we will get that into the chat soon. And while we're talking about that, if you have any other questions, please feel free to throw them into the chat as we'll be getting to those soon. But while we wait on those, Linda, we will come back around. And I know that there is one concern that has been expressed with the apprenticeship model as it relates to compensation. On one hand, it seems a little odd to ask young adults to apprentice their way into what's often a minimum wage role. But on the other hand, am I right in my understanding that some of these programs actually enable job candidates to enter the workforce at a higher rate of pay and perhaps with credentials like a CDA?
This is a particularly, I think, challenging piece, and we have talked to programs, and I will tell you, there is no simple answer to the question or the challenge. Okay. There are, I see in the chat where there have been a few questions asked about, what did we learn about maintaining the wages? Where is it working well and so forth? And I can tell you that, and there are a number, as I said, programs, West Virginia, Pennsylvania. There's an absolutely fabulous program out in the Bay Area, out in California. And there's no one answer to how they fund it, but I would tell you, and anybody looking, I mean, we've spent a lot of money in the last few years, mostly because of the ARPA dollars that have gone into this funding. And there is concern that it's running out, and what will we do about that? The programs that we've seen that are committed to apprenticeships, I know this is not what the audience probably wants to hear. For the most part, they piece it together. And that's always a challenge. And that's part of why there needs to be funding also for the apprenticeship infrastructure, because there is, not only is it expensive to get it going, but then it's expensive to do the work that it takes to get the funding, keep the funding, et cetera. It's like a lot of nonprofit efforts in this country. It's not well funded. I also have something that we said yesterday, and I've said this routinely, that some people on this call might not want to hear. In the Child Care and Development Block Grant, there's a requirement that states spend 12% of the funds on quality improvement efforts. Okay. Totally, when you look at how much we spend in CCDBG, when you combine the transfer and the TANF transfer into CCDBG, we are spending in this country over $1.2 billion on quality. Now, I would ask the audience this question. And that is, what is more important to the quality of a childcare program than the qualifications and stability of the workforce? Yet if you look at how we are spending those quality dollars, we have very little accountability for any outcomes. And I would suggest to states that are really interested in creating a pathway, and that again is a critical word, that apprenticeships provide a pathway for getting employees from one level to another and rewarding them. So how are we spending our quality dollars? I don't think it's the ultimate answer to this, by the way, but it's one thing that states can look at when they try to create some kind of, pathway and wage incentive program. Can we use some of those quality dollars for this effort? Because I think we have and have routinely over the 25 years I've worked in this, had no accountability for the quality funds, pretty much. I mean, we know they're being spent on it, but we don't know what it's buying us in terms of the workforce and this critical wage issue. Does that, I think that there is, aside from that, there is no simple answer to it.
Thank you. And
Can
it
I
is,
add?
Go right ahead.
Well, I just wanted to acknowledge that we have in the chat a couple of other questions about family childcare in particular, and there was one from Maryland. We know that Rhode Island had a family childcare model. The West Virginia model is family childcare. So there are some really good efforts, and I never want to leave out our home-based providers because they're so critical to the system.
I think that's very important to note that we have our home-based providers are an important factor into the childcare crisis that we have. It's an important piece into the puzzle, and it all comes together into there. But definitely, when you speak towards apprenticeships, it is as you said, it's a complex problem with not a one-step solution towards all. And thank you for all your work towards that, and thank you for talking through that with us today as well. And we'll move towards Leslie coming back around. And one of those other gaps that we hear a lot in the childcare world is benefits. Healthcare and retirement, for example, aren't necessarily the norm for the field. So how do or might shared service models help to improve that situation?
Great question. So we are actually doing that through our shared services network now. So we currently offer supplemental insurance, which vision, dental, life, and accident. We offer docs by phone, and we offer teletherapy. And there are multiple ways that you can do that. You can do it as an individual plan for $10 a month and get those services, or you can get it as a group rate for $8 a month. And we push for our centers who are members to utilize that as a staff retention tool. So $8 a month, you can offer these insurance options to your staff as, the possibility to gift them insurance. I mean, you're giving them docs by phone instead of, healthcare per se, like a dental, a health card, but also giving them the opportunity to have vision, dental, accident insurance, et cetera, for only $8 a month. And that includes all members of the household. So it's a pretty incredible deal, and also a pretty incredible deal for staff retention. As part of the telemedicine program, members receive access to prescription discounts. So it gives them prescription discounts on top of the telemedicine. You can cancel anytime, 15-day money-back guarantee. So it's got some pretty cool options in there. You can choose your own physicians based on the health grade reviews. There's video calls, from your computer or smartphone. And then we also have life insurance categories that you can choose from. And then also the options for short-term, long-term life and accidental death and dismemberment policies are also available. So all of that is part of our membership to our shared services networks for either $10 or $8 a month, which is pretty incredible. when are not many options for childcare providers. So what we also did is we took it a little bit further in South Carolina, because that is an option for for all the states that offer the resource platform. So there are, I think, like 32 or 33 states currently that have a resource platform through CCA Global. So I noticed in the chat that there were a couple of people who have said that they love their shared services in their state, which is amazing. So thanks for that shout out. But what we have also done is one of the things that I mentioned earlier in my my talk was that we had the preferred vendors, so the local vendors on our level in our state. So we contracted with an insurance broker to become a preferred vendor on our site. So most of our preferred vendors give some type of a discount, but what this vendor does as a broker is she's really just kind of there for education purposes and resources. So part of her education is just really to show or to educate both directors and frontline staff about how they can afford insurance. And then to serve as a reference on, explaining how they can sign up on the healthcare exchange, giving them, walking them through the steps on how to do that. We decided as we started talking to this preferred vendor that we wanted to go even further with her. So we decided to offer her a spot on our board of directors. So now she's giving us even more information on how we can be helping and childcare providers in our state, how we can maybe help make policy changes. But it allows us to, chat with her on how to take steps to investigate how we can do more for the field in general. Because we recognize that, a lot of this field are women. We know that. And a lot of times they're single women. And so, and single moms at that. And so they're having to, try to figure out how they can pay for things because we know that the wages are very low, but then figure out how they can insure themselves and their children. And so we think that if we can kind of help make policy changes on, wages and benefits, that's a big part of how shared services can make a difference in this field. And so we're working with our state, but also collectively nationwide on how we can figure out a way to shift that and fill these gaps in both, the wages and the healthcare crisis. Did I answer everything?
I believe it does. Thank you so much. And I have one final question to ask the entire group, and then we'll kick it over to some of our questions that have been coming in. So as you think about everything that you shared, what, if any, policy changes do you feel that are needed out there to help some of your particular innovations thrive and scale? And I'll open that up to you, whoever would like to share first.
Well, I kind of just said two of mine. The gaps in healthcare and wage benefits are big for us right now.
Yeah, I will jump in on this one because I think when it comes to whether it's apprenticeships or the wage issue or the actual professionalization of early childhood in this country, I think one of the things holding us back is that most people and most public officials really don't understand the business model of childcare. And it's not so simple as to, raise the wages, which, means raise the fees to parents. That's the way our system works. And it is going to ultimately take some public investment in this whole childcare area to be able to pay people what they need and what they actually have earned versus without, increasing what we charge parents in this program. But I think that when, most of what our work has been of late has been trying to educate the business community and legislators around this country as to the business model and why it is failing us. And we're not going to get better until in my opinion, expand the table and we get more people to the table, which helps more people understand why our system is so fragile. And it really is fragile. And so there's just not easy answers other than we just need the resources.
I think when it comes to, I'll just speak specifically to the incubator work and some of the other policy and potential changes here in Connecticut. So for the incubator specifically, I had mentioned the current statute of which the incubator is operating under, including the 7 communities and through, I believe it was 2026. And so we're currently in our legislative session. So I'll talk about the proposed bills that are going through the process right now, but there is a proposed bill for the incubator to expand, right, the number of communities where an incubator pilot can operate and also lift up the restrictions around the timeline for the licensing component piece. And so when we think about expansion and sustainability, those are 2 potential ways through policy that is being looked at and considered right now. When it comes to the Blue Ribbon Plan, also currently going through legislation, is around the combining of the funding streams. So really looking at what is in statute and what needs to be changed in order to take 3 funding streams. For us here in Connecticut, that's our child daycare contracts, our school readiness programming, and our state Head Start funding, and bringing it under one umbrella to do, reduce the burden, simplify the process, really streamline the process and create efficiencies within our system for both providers and families. And so these are bills that are moving through, and we shall see what the end result is at the end of session.
And that's one of the questions that we do have in our chat, talking about if there's anything you learned about some of those funding sources of maintaining wage bumps or cost of living increases over time. And Elaine, I think that was directed towards you or Leslie.
Can you repeat the question? I'm sorry.
If there was anything that you've learned about all those multiple funding sources and what they can handle towards maintaining salary increases, wage bumps, and those cost of living increases over time. If they can keep up with that.
Yeah, that's an excellent question, right? Because I think as we think about stabilization, right, a stabilized funding source that comes into a business or a program that directors and owners can expect to receive and be able to plan and work their business model off of is extremely important. And I think I'll just underscore what Linda, mentioned around, right, the business model is broken in a sense. And so we do need to have that awareness as well. So some of the changes that we're looking to propose around funding is that all of our providers that are state funded are paid upfront, and they're paid directly, and they're paid quarterly. So they know what to expect and have that funding at the beginning instead of being in the rears and having that be a very challenging business practice to manage and to sustain and to really plan and use. And so those are some of the mechanisms and the strategies that we're looking to change in order to try to make the system work better for providers and work better for families and be more efficient.
We have about 5 minutes remaining, and I have a question here around, and Linda, you've touched a little bit on this already, but that important role of what do you feel that the employer's role could play in supporting and promoting that innovation into these innovations and the childcare sector?
Well, I'll jump in on that one. As many on the call know, we've been working in partnership with the U.S. Chamber Foundation for the last couple of years, and trying to get more businesses to support early childhood. Because when it comes to, moving legislation in particular, businesses really matter in state legislatures. And I think we've seen a lot of progress in the states we're moving in. What their role is, I think, where some of these become personal, positions. My position on this is that we need business at the table. We need their support to get this fixed. But I'm not one that believes that we ask them to fund it necessarily. And I think that that's where when businesses think, oh, you want me to build childcare, for example, it's a very complicated business model to begin with, and one that's extremely difficult. And it's not most businesses' line of work. And so I think what we need to say to them, it's fine if you build a childcare center or you do other things, but more importantly, we need you to support us in figuring out how we fix this. Because we're not going to get anywhere until we reach outside of our own bubble and figure out who to bring to the table. And that's, again, a personal opinion somewhat, but it's also part of helping the business community and the public understand why this is such a broken model. As Elena said, it is broken. And I think that we're not going to fix it until we get more people. And the one thing, I applaud what Connecticut has done. They've done a fabulous job. Connecticut puts money into childcare. They have a priority on it. There are many states in this country where they don't even put enough money in to draw down the federal money. So, we've got challenges both inside the profession, inside our states, as well as, just nationally. I don't know if that answered your question at all. I'm sorry if I got off on a little soapbox there.
No worries. Thank you very much. Leslie or Elena, anything to add to how the business community could be adding to the childcare crisis in relation to these models in the last minute or two?
Yeah, so this is something that our Governor Lamont is very interested in, and has taken steps in order to engage the business community. He has been able to increase tax incentives for businesses to either open childcare centers on their campuses, or and what we support also is working with community-based organizations to make connections to their employees and to provide, subsidized support for their employees to attend community-based childcare programs. And so that's one current way that's already in effect through the Blue Ribbon work. We had businesses at the table. We did specific outreach to the business community, and including our Connecticut Business Industry Association. And so one of the innovative pilots that's mentioned in the Blue Ribbon Plan that we hope to have some funding to move forward is out of Michigan. And so Michigan, if you're on the line, thank you, the Tri-Share model, where it is a third of the cost is paid by businesses, a third of the cost is paid by the state, and a third of the cost is paid by families. And really think that shared kind of funding model and approach is an innovation that we'd like to see, implemented here in Connecticut.
Well, thank you so much.
Oh.
You got time for a quick comment, Linda?
No, I was just going to say, yeah, we're learning a lot from the business community, and the business community was very helpful in Kentucky in getting all childcare workers qualified for subsidy. And if you look at the cost of childcare for a childcare worker, most of them can't afford childcare in the centers they work in. And so by making them eligible for the subsidies, And that was a partnership with a lot of people in Kentucky, and business came to the table to support it. But they came to the table because they understood why the problem existed.
Yes. Thank you so much, Linda, Nicole, Leslie, Elena. Thank you so much for everyone joining us. This was our Early Efforts webinar series, and we hope you can join us again next month for our next session. Thank you again.
Thank you.